And with over 260 million views, the hashtag IBS TikTok is trending. How a topic that's long been taboo is being normalized and what people can do who live with it.
Thank you, Colton. 8:06 is our time right now. Between 5 and 15% of people in the United States have IBS, or irritable bowel syndrome. You've probably heard of it. It's pretty common, but it's also a chronic disorder, and sometimes people don't want to talk about it. It's a little scary, a little embarrassing, taboo topic, right? So April is IBS Awareness Month. So here to talk about what you need to know, what it really is a gastroenterologist with Arizona Digestive Health. We have Dr. Nayan Patel joining us this morning. Thanks for being here, Dr. Patel.
My pleasure. Thanks for having me.
That's the big thing, right? Nobody wants to talk about it. Like, it's something with my stomach, I'm in the restroom, it's taboo. But we need to talk about it because of how common it is.
Yeah, it really affects about 35 million Americans.
Wow.
And it's a disorder of the movement of the intestinal tract, or the function of the intestinal tract, how it works.
So how do you know if it's even time to see a doctor? Because I think most people will say, oh, it's a stomach, issue. I don't do well if I eat this or that, and it's not a big deal.
Yeah, I think certainly if the symptoms are severe, if there's alarm symptoms such as weight loss, blood in stool, waking up at night with symptoms, it could indicate another condition. Irritable bowel syndrome itself is really defined by having an average of 1 or more episodes weekly of abdominal pain, which is associated with altered bowel movements such as constipation or diarrhea. There can be urgency, there could be associated bloating, and that's really the truest form, and it can vary from being very mild to very severe, but certainly if it's not controlled by lifestyle measures, that's the time to see a doctor.
You talk about controlling. I was wondering, what can we do, or what do we do that's bad, that can irritate and make it worse?
Yeah, so it's certainly a complex and multifactorial problem.
Sure.
We know that there's a strong element of connection between the brain and gut. So, easy things are reducing stress and anxiety, getting good sleep, getting exercise. We know there's dietary components. There's hypersensitivity in the gut, and certainly there are certain foods, whether it's certain processed foods or certain poorly digestible foods, which can make symptoms worse.
And for every person, it's different, right, of what may be a trigger?
Correct. Yep. There can be episodes and periods of stress or anxiety. There can be episodes related to alterations in the organisms, the gut microbiome, after an infection, after antibiotics. Certainly dietary factors can do it. So there are various mechanisms that can play a role.
I think after hearing this, a lot of people are saying, I think I might have IBS after hearing all those different symptoms or the things that affect it. When we talk about finding a doctor, obviously we know, you should be checking in, doing your yearly exam. But how does diet truly affect, should you be watching what you're eating on a regular basis anyways?
Yeah, I think more and more, we've in gastroenterology, we've seen the role of diet. We know fiber is helpful for the intestinal microbiome. We know that over the years we found that processed foods can cause a lot of symptoms. There's an increase in colon cancer in a younger population, and a lot of that's attributed to lifestyle issues, including dietary factors like highly processed foods, a lot of red meat.
Which unfortunately is a part of many people's diets these days, with everything being fast food and on the run. Before we go, can you talk about what people, I guess, most commonly sort of just say, it's not a big deal and move on, but what they really need to consider when they need to seek help?
Yeah, I think they really need to seek help if they're having what we call alarm symptoms, and your gastroenterologist or your primary doc should be asking some of these questions, like an unintentional weight loss, blood in stool, just severe symptoms, nausea, vomiting, worsening symptoms, sometimes certain lab abnormalities like anemia. These are all things to watch out for.
Well, we hear it's all connected to our gut, so it sounds like it really is in this case. Thank you so much for shedding some light on that. We appreciate it, Dr. Patel, for being here this morning.
Yep, you're welcome. Thank you.